CA9 has been found to be selectively expressed on tumor cells in a couple of cancer types and very little on the healthy normal cells in those same tissues. Therefore, it offers a great potential therapeutic window for the patients, only hitting the cancer cells and sparing the healthy ones. Hello, I'm Norbert Weidemann. I'm working at Debiopharm in the Translational Pharmacology unit. DPI-4452 is the peptide that specifically targets CA9, and when it carries lutetium as a radioelement, we call it Debio-0228. In this particular case, we wanted to see if our peptide can also be used with other radioelements that emit a different type of radiation and therefore have different properties in terms of reaching into the tissue and also the amount of energy that they deliver, which comes also in most cases with a different safety profile. So when our peptide can be shown to work with multiple different radioelements, we just have much more options of applying that drug in the clinic. Our research showed that our peptide DPI-4452 is a very versatile agent that not only can be used with beta-emitting radioelements like lutetium that we're using in our ongoing clinical trial, but it can also be used with alpha-emitting radioelements like actinium. The benefit for cancer patients is that the peptide can be used as a theranostic agent to identify the patients who would benefit from treatment and then go back and treat them, and it would avoid to treat patients that would not benefit and maybe unnecessarily suffer from side effects. And in general, you would also expect less side effects than, for example, traditional radiation therapy, because it is only targeted to the cells that express the target and not going through a lot of normal healthy cells. Importantly, it also, since it's a systemic therapy that is administered via the bloodstream, it reaches all the lesions in the body, even those that you're not necessarily aware of they are there. It is important because there's a huge unmet medical need for many patients because they don't have an option that works for them. So we always need new innovative, new treatment approaches. And our research has shown the potential to use our compound for diagnostic and therapeutic purposes, and we really hope it will become a first-in-class standard of care for patients that urgently need a new treatment.